Cancer patients often have treatment appointments scheduled just weeks apart, making it difficult to travel back and forth to their rural homes due to the cost. Many have no option but rely on the temporary care home, which lacks adequate space. Annette Namudu, a spinal cancer patient from Nakaseke district, has been living at the care home since her diagnosis in 2021, whenever she cannot afford to go back home in between appointments. She says traveling between Nakaseke and Kampala for appointments is costly and exhausting. This shelter is her best alternative.
Transport.
One might say that transport is not a lot, but on my side I cannot afford it. I am a single mother who has to take care of many other things.
Darius Mubone, diagnosed with prostate cancer in 2023, faces similar challenges. Traveling from Rukunjili for weekly appointments is costly, leaving the temporary care home as his only option.
The doctor told me to come back after 2 weeks, but I did not have transport to take me to Rukunjili, then I come back. It's about 80,000 shillings now. It's a festive season. It's about 100,000 shillings.
The care home, established in 2022, provides a much-needed relief for patients. However, it is overcrowded with about 250 patients relying on its services. During peak periods, the number of patients often exceeds the available tents, forcing some to sleep outside.
But right now, since it's a festive season, they have gone home. Some of them are coming back in January, February. So right now, the situation here is not that bad. We don't have anyone sleeping out because they've gone home. So, but usually sometimes it's overwhelming in that some of them sleep outside here on the floor. When it rains, they go in and just sit.
Some of the patients who spoke to us off camera say male and female patients sometimes share the same space, but Uganda Cancer Institute says the mixed gender cases refer mostly to caretakers.
We have 2 tents for men now. We had 1 initially. So, but if you see a woman in the men's tent, she's a caretaker. So women have their own tents. But also women can have male caretakers.
Initially, the Uganda Cancer Institute had no space for these people, and the sick used to sleep in the corridors until a temporary care home was established around 2022. Some well-wishers have stepped in to help. Today, some donated additional tents to ease congestion and food supplies.
Found women dripping with blood because they didn't have sanitary pads. We found people sleeping outside under trees because they didn't have anywhere to sleep. So whether it's raining or it was shining, and imagine going through cancer and then sleeping under a tree.
This tent will help us accommodate more like 50 patients. So those who have been sleeping out will have now space to sleep inside.
However, stakeholders say that these tents, which typically last 2 years, are not a sustainable solution.
We have 5 tents now and a main house, the old house. It was a former house for the Idi Mulago. It's also helping us accommodate around 100 patients. And then also it's a temporary place. We need a permanent structure for these patients, for them to be able to complete their treatment and get well and go back home to their people.
We asked, can we build something permanent? And we got told we're not allowed to, which we understand because it's the centre of Kampala. So we can't build something permanent here. But if we can, we'd love to.
The Health Ministry says they are yet to establish more regional cancer centres to reduce the patient load at the Uganda Cancer Institute. Cancer is a battle no one wants to fight. The demand for cancer care continues to grow, with over 30,000 new cases registered annually. Nobat at Kunda, NTV Weekend Edition.